The lawyers made me say what you all know anyways. This podcast does not create a doctor-patient relationship. Please listen to the short, informative disclaimer at the end of this podcast. Hey, I'm Dr. Matt Kettman. Around here, they call me Dr. Rock. Well, I wish they did, but welcome to Dr. Rock's Family Practice, where we tackle health with straight talk, big laughs, and real solutions. No fluff, no nonsense, just the tools you need to live your best life. Let's get started. Okay, good afternoon. Dr. Rock here. Dr. Rock's Family Practice. I am Matthew Kettman, MD, and what an awesome day we have today. I have a wonderful man here that I'm super excited to talk to and to present to you, and who's going to help you. The theme of better is always trying to get better or make you better, and what we have today is a special treat, and that is Eric Rottinghaus, DC, from my hometown, from my school. So how are you doing, sir?
I'm doing great. Thanks for the invitation.
Oh, man, I'm so glad you accepted. So, well, I am excited to have you on, but as I start most of my shows with asking a little bit of background, I am a superhero comic book nerd, and I want to know your superhero origin story. If you could just give us where you're from, what you've done in your life, and how you got here.
Sure. So I grew up on a farm and went to Don Bosco, same as your alma mater.
Yeah.
I married my wife's named Trila. She's a teacher. We've got two great kids, both in college. My son Kyle's down at Iowa State. He's doing the Navy ROTC program, working through his engineering and physics degrees.
Awesome.
And my daughter Kavanaugh is at University of Northern Iowa. She's going to be a sophomore this year. And she is studying right now to be a mental health counselor, but that's still up in the air. She's still got a lot of learning to do. I decided to become a chiropractor when I was in undergrad, and my mom was really struggling with headaches, and she wasn't having good luck with the traditional medical approaches. So I started doing some reading about different options, and I found chiropractic was really good for headache. When I started reading more and more about it, I stumbled upon this research study that was out of Canada. At the time, Canada was trying to decide whether their national health system was going to be adding chiropractic to the mix, and they put out this big meta-analysis called the Mango Report that recommended chiropractic for entry into that system. And so I read through that, and I just decided if it was good enough for Canada, it'd be good enough for me to. Between the time that I started chiropractic and the time that I got out, not only did my mom have headaches, but she also had basically a broken lower back vertebra called a spondylolisthesis, and that caused a disc bulge. So I got to work on headaches for quite a while, and also her lower back. We kept her out of surgery, which is a fun thing.
That's awesome. And now do you treat headaches quite frequently?
Oh, love to treat headaches, love to treat lower back pain. Some of the big things we see a lot of. Yeah.
Thank you for your backstory. So anyways, I used that joke already on Andy. So anyway,
Yeah.
Dr. Jolly.
I expect to hear the constipation joke here later too.
Yeah, I way overused that one. And then my wife put it on the Facebook page too. And I'm like, one of my employees
Yeah.
says you're using that joke too much. So
I thought that maybe you did that entire podcast just as a
just so I can use that joke. No,
Yeah.
because I'm using them multiple times
Yeah.
a day. Okay, awesome. Okay, so you guys are at Summit Chiropractic. You have two partners, is that right?
Yeah, we have a physical therapist and another chiropractor. Dan McGrain and Dr. Jolly and I are all partners in that office. Yep.
I got to get Dan on the show next. So that would
He's
be awesome.
fantastic.
Yeah, he is awesome. Okay, and tell me, are your philosophies different, the same? Do you guys collaborate a lot?
Yeah, so that's one of the great things. It's pretty unusual for chiropractors and physical therapists to get along. We have similar but competing philosophies in a lot of ways. And so that's one of the great things that we were able to do is to find people who have a lot of overlap in how we think about things. We work on the spine, trying to get good motion in the spine and help with that. And one of the things that physical therapist is really good at doing is helping with the stability of the muscles and helping to improve coordination and all the other important things like flexibility and proprioception. Knowing where your body is in space is all really important to keep your spine stable and then the rest of your body as well.
Awesome. Okay, that's great. So do you guys have, do you use different tactics or techniques, I should say?
But Dr. Jolly and I are very similar in the way we treat our patients. I like to say that it rhymes, but we're always going to be a little different just because we have different levers. I'm taller and, he's not tall. So what am I? And so our chiropractic adjusting styles are very similar. On the physical therapy side, it's a totally different game because it's really about active therapy. Passive therapy is when a patient comes and lays down and we, the provider, does something to them. And then active is when the patient is actually doing something themselves. And so doing those active exercises is really what builds that stability and control and helps stabilize things in the long term.
All right, so great. So tell me what a typical patient or typical day looks like for you over at Summit Chiropractic.
A typical patient will come into the office and we'll do an assessment. We'll have them move in different ways. And I always tell them that we're not going to try and torture them, but some of the things that we have them do are probably going to hurt. And that helps us to figure out exactly what's going on with them. So we'll have them move in different ways and bend in different ways and touch them in different ways to try and elicit that pain to reproduce it so that we can then formalize and direct the treatment at those areas that need it.
Gotcha. Okay. That's awesome. I would like to get into a little bit more about how your office works, if you don't mind. Let's talk about patient specific type of stuff because I want the audience a better. This is going to ring true for a lot of them. Okay. Could you comment a little bit on acute back problems versus chronic pain, failed back syndrome, and how, if somebody's out there living with these kinds of things, how, if they've never tried chiropractic, how that would look? How would that be different for a chronic person who's had pain for years? Or someone who just hurt their back a couple weeks ago, and can you help both?
Yeah, thank you. It's a great question. One of the things about acute pain versus chronic pain, we make a 3-month window. So acute pain is anything less than that, and chronic is more. One of the things that happens with chronic pain is that people change their movement patterns, and then you have compensation where other parts of the body start to have issues. And so you may start with a knee problem, and then the next thing you know, you've turned off some hip muscles. And so when you walk, you limp, and now you've got problems in your sacroiliac joint and into your lower back, and it can work all the way up into your neck. I just had a patient come in recently, and she has been having pain. She came in and she said, "I'm sorry it took me so long to get here. I wasn't really sure if this would help or not." And of course we said, "No, that you came in when you needed to come in, and obviously you can't take care of anybody else if you can't take care of yourself." One of her children has significant disabilities, and she still has to carry and lift this child. She came in after the 3rd treatment, I think, and she said that she hadn't slept in 10 years through the night. And that was pretty cool to have her tell me then that she started sleeping through the night after only a few treatments with me. One of them.
That's interesting because I have people that fall asleep while they're listening to me talk. So
I'm afraid people are going to do the same thing to me right now.
Oh, no, you're doing great, buddy.
Yeah,
okay, so that's amazing. How is she now?
She's doing a lot better. She had some of those compensation problems that I talked about where her hip was causing her a problem that went up into her upper back and into her neck. And I would say she's probably 30 to 40% better after about 6 treatments. So we can definitely help with chronic pain. Now, what I always tell people that when it's been chronic for more than 3 months is I can't predict how fast you're going to get better. I can't predict how much work it's going to take, and I can't predict what your new normal is going to be. What we're going to do is we're going to work on you until you get to your new normal 100%, and then we're going to do our best to maintain that down the road.
Awesome. I know you work very well with me, and I work very well with you because I'm very open-minded, and so are you. But would you find that most doctors are open-minded to chiropractors?
It's much better than it used to be. We have quite a few people such as yourself that are friendly to the clinic, that refer patients over to us, that we have a good relationship with. There are some that are pretty skeptical of chiropractic, and they're concerned about some of the side effects, and they're concerned about some of the history that we in chiropractic have. And while we don't necessarily follow all the typical chiropractic ideas with the way that we practice, we kind of get lumped in with some of those other folks as well.
Is there any risk to getting adjusted?
Sure. So the risks in chiropractic are relatively low in general compared to other interventions. One of the biggest, most common things that happens is soreness after adjustments, especially after your first treatment. I always warn people the first time I work on them that you may wake up in the morning and take my name in vain. You might be sore, stiff, achy, that sort of thing.
Sure.
Yeah, but that's the most common one by far. There are some potentially serious complications that can happen. And one is strokes. They are very, very unusual. The research that has been published.
How would that even happen?
So there's an artery in the neck, and the idea is that the artery might get stretched when we put the neck into certain positions to do an adjustment. So
is that true?
It may be true. There's
rare.
Some, it's very rare if it does happen. The research that's been out there compared the risk of you going to a chiropractor and getting a stroke to the risk of you going to a medical doctor and getting a stroke. And it turns out the risk is identical whether you go to a medical doctor or to a chiropractor.
That's awesome. That's awesome.
Yeah. So the idea is that people may be coming in with an artery in the neck that's already tearing, and then they seek care for that neck pain that's caused by that artery, and it's missed. And it might be missed by both chiropractic practitioners or medical practitioners.
Oh, yeah.
But at the end of the day, because it's very hard to tell the difference between regular neck pain and neck pain that's being caused by this artery type.
I've had a couple, a carotid artery or vertebral artery type section, or an artery just rips on the inner lining.
Exactly.
That could be a big stroke. That could be a big problem.
Yeah, devastating when that happens, for sure.
But how many neck pains are actually that? It's so rare, right?
Yeah.
It's going to get missed on both sides frequently, right?
Between 1 in 200,000 and 1 in a million is the number.
Oh.
So you're as likely to get hit by a car on the way into your office visit as you are to have
much more,
problems.
I would guess, right?
Yeah, it's very rare. Chiropractic is very safe.
I love it. Okay.
Yeah.
What about supplements for people that are having muscular, like skeletal pain, back pain, neck pain, this kind of stuff? There's a lot of things I hear about out there that may or may not work, like turmeric, over the counter, glucosamine, MSM, CBD now is very popular.
Yeah,
Do you have, yeah,
I've had a number of patients who use CBD and they've had mixed effects. A lot of them have had really good effects from it and started using it as part of their normal daily activities, but some of them have run into trouble with it. I've got truck drivers who come in. We do a lot of DOT physicals, and those folks are not allowed to use any sort of cannabis whatsoever if it has THC in it. And some of those CBD capsules or supplements are not particularly well regulated, so they may have THC in them, and they
that might be why they work.
it might be why they're working.
Right.
Absolutely. They're feeling
Hey,
really,
this
really
is
good.
great. Yeah.
Yeah. But the positive drug tests because of it, and
Oh,
it's caused them to have to go through a lot of work to get back on the road.
okay. So tell me, as a DOT person, now, like, I think all 50 states have some sort of legal hemp based THC over the counter type stuff now. How does that look? I mean, most of the people that are taking it probably have no idea it's going to turn a drug test positive. And can we enforce that if it's over the counter everywhere? It's very hard to regulate.
Yeah, it is very hard to regulate, especially with some of the is it Delta 9 THC? They've changed, I don't know,
Yeah.
but it made certain active psychoactive THC components legal to sell, but that doesn't necessarily mean that they're going to be legal for those folks that are driving
Right.
over
Depends
the
on
road.
mostly it's an employer based thing, you're saying?
No, it's a federal thing. These truck drivers have to do random drug screenings in order to maintain.
So some jobs are federally regulated that they cannot
If
use any of these
if
products,
you're
or they have to be
commercial,
CBD only. And some are just the employer says you can't use any THC at all, CBD type stuff, and we're going to
sure.
test you. Okay. All right. Very good. Okay. Yeah, it's going to be very difficult because I don't even know, is there a way to acutely test someone who is intoxicated with THC?
I don't believe so. I believe that
I
you
think
can
it could have
tell if
been
it's in their
30 days
system.
ago versus, yeah. So I just don't know what's coming. Okay. So do you have any opinions on things like turmeric or glucosamine, or not that interested, or don't know if it helps that much?
Turmeric is interesting with the anti-inflammatory properties. Some folks have had really good success with it. The glucosamine has for joint pain. I know several people who they know exactly when they stop taking it because their knee pain returns.
Yeah.
So there's definitely some value in some of those things.
Oh, I've had some value. I think I ran with, there's some studies on these over the counter joint pain type of supplements. That's not the issue. I think the issue is it really the stuff? Most of the stuff, I think there was a
Oh,
big study that said most of the over the counter stuff doesn't have what it says it does, or the amount, or it may have extra ingredients, and that's legal.
yeah, that's the trickiest part about those is how unregulated the supplement space, not
Right.
only with what's in the bottles, but also with the claims that they make. It's a free for all.
I agree. So yeah, I think there's some good stuff out there, but you got to get the right stuff. Now I always send people to Greenwood because they use products like Thorn and Zymogen that are really good. Okay, do you have any opinion about diets, like anti-inflammatory diets, in terms for musculoskeletal type of complaints or health
So
or health?
yeah, one of the biggest things in terms of diet is getting yourself to a point where your joints can handle the load you're putting on it. So if you're doing a lot of running, that's a lot of forces through your joints. And so if you are carrying a lot of extra weight around, it's going to be a problem for you.
So back to the supplements. Is there any that you think are dangerous, or you actively discourage your patients from?
The biggest thing is making sure that people who are in safety sensitive roles are aware that they need to be very careful where they source their CBD
Oh
because
yeah.
because
Okay.
that will absolutely drop a positive test if they don't get it from a good source. And there's been a lot of cross contamination.
I see. So, do you offer anything else beside chiropractic and physical therapy?
Yeah, sure. So we've got, of course, chiropractic and PT, but we also have an athletic trainer in the office. Her name is
Cool.
Manila. Yeah, we sent her to Jessup. We had her going there for several years now. I think
Oh, you have
six
more than
years.
one clinic, right?
Yeah, we've got a clinic out in Jessup and one in the Waterloo area. And so Manila's doing a lot of cool things with our athletes. She does injury prevention and she does screenings for potential injury, checking the athletes to try and help keep ACL tears, especially in the female athletes, from being an issue. About a year ago, she started doing dry needling, which we found to be fabulous for a lot of different musculoskeletal problems like tennis elbow and shoulder pain and things like that have just really responded great to that technique.
Awesome.
Sure.
Okay. So, I think another common misconception about chiropractic is you guys just do backs or necks, right? I know you guys can treat a lot of things, and I don't think people know that. So, what other areas in your practice do you like to work on and have success with?
Yeah, a lot of people are surprised that we do things outside of the spine, but I always tell people if it's got a joint, it's a chiropractic issue. And
Gotcha.
so there are some bones in the ears. Probably the most surprising adjustment we do is an ear adjustment. It helps to open the eustachian tubes, take some pressure off of that eardrum. People get a lot of relief from that. We also see a lot of plantar fasciitis at the clinic, a lot of foot pain, a lot of ankle pain, a lot of knee pain. And so we really enjoy working on all those things. And sometimes those are chiropractic issues, and sometimes they respond really fast. And if they don't, that's when we oftentimes will send them over to physical therapy, to do dry needling, to do whatever else we've got in the clinic, because we've got a bunch of options to offer people because there is no one size fits all for a lot of these problems.
That was a good answer. All right. I know how we work together. I think that's ideal because I like what you do. I respect what you guys do over there a lot. And I think you guys respect what I do. And so, give us a real time world example of how the best of both worlds, medicine and chiropractic, can work together and how you utilize those relationships.
Yeah, at times we are limited on the chiropractic side with the way we deal with insurance. The insurance world is fairly complicated. So I can think of one example where we were working on a patient in the clinic and we were pretty sure that there was a problem that we needed to get an MRI for on this patient. And I think I texted you. We just had a quick text conversation and you ordered the MRI for us and we got that patient right where they needed to be pretty quickly.
And I think I had to see them first for the insurance to cover it.
We've got existing relationship with you, which is amazing. We can just pick up the phone, we can text you, and you send people to us the same way. We send people over to you for maybe we wanted to do a PRP injection in the shoulder, which has been a really helpful for a lot of our patients. Or maybe you have somebody that's got an acute case of low back pain that they need to be seen right away, and then we can squeeze that person in. It's pretty great. We've also got a great relationship with Dr. Polk. We send a lot of people over his way because he can get them in right away, and we've had great feedback from our patients that we've sent over there with how attentive he is.
Yeah, he's got a great walk-in clinic over there, right?
Yep, it's fantastic. And they're able to get people in, and just like you, and just like we hope we do, he's well known for listening to people when they come in and actually understanding what's going on.
All right. So working together with the medical community, do you guys screen for medical conditions that maybe a chiropractic cannot take care of and identify those and get them to the people that they need to?
Yeah, so just a little background. In chiropractic school, the person who was teaching us how to adjust said, I can teach a monkey how to adjust in 6 weeks. What you really need to learn while you're here is when not to adjust.
Can I get one of those monkeys? That's awesome.
Maybe.
So that's a very good adage in most kinds of medicine is over treating and is just as much of a problem as under treating or mistreating sometimes.
Absolutely. And we've all got a bias to action. And when you have a hammer, everything tends to look like a nail. So one of the things that we try and do though is really watch for red flags when they walk in. One day I had a gentleman come in, and it's a patient I'd seen before. I'd seen him for sciatica before, and he comes in and he says, "Hey, I've got the exact same thing. Can you just give me a quick adjustment?" And I looked at him and he just didn't look right that day. It was not quite the same as he had been the last few times. I laid him down on the table, did an assessment, and it turned out that this guy, like we had talked earlier about the dissection or the tearing on the inside lining of the artery, he had that, but instead of in his neck, he had it in his abdomen. There's a large vessel called the aorta, and he actively at that time radiating pain down his leg because the vessel inside his body was tearing. Luckily, I did not adjust him that day. It would have been a very bad day had I adjusted him for both of us. So I sent him, his wife was there with him, and I said, drive him to the ER immediately. And he did. And fortunately, he had a good outcome. He got down to Iowa City and they did a repair. And I still see him from time to time now.
That's awesome. That diagnosis, aortic dissection, is not always a good outcome. So that's good for you. That's awesome.
And that's the train. And that's what we try and do is we can't always help people in the office, and we have to be humble enough to understand that and try and get people to the right place so that they can get the right treatments.
So with that unique partnership at Summit, how do you guys think you're different than other offices?
I think Dr. Jolly mentioned when he was on the podcast last time that we may have been the first chiropractic and physical therapy clinic combined in Iowa. And that collaboration that we do is a lot different. We can have meetings in the hallway where our physical therapist has been working on somebody and just has to ask a question about what's going on. Or I ask a question of him like, hey, I've got this strained shoulder. Could you take a look at it? Because Dan does an amazing job with shoulders. He does a better job with shoulders on the physical therapy side than we can do on the chiropractic side. So just being able to easily interact with people really is a little bit different. And on top of that, we are very aware of how people's lives don't focus around us. We want to give them what they need and not necessarily a lot more. So at our clinic, we really try to be as collaborative as we can possibly be. In addition, we really try to focus on the evidence, and we're going to update the things that we do as the evidence changes over time. Some other places are built more around philosophy, and we really like our approach, and we really try to focus on what the patient needs and help them to achieve.
Now we've got to that point of the show near the end where, in addition to thanking you very much for being on this show, because you've been an awesome guest and an amazing resource for health. And I highly recommend that if you have any issues, people come and see you. I want to ask you, so if you had one message, one piece of your brain, one life philosophy, one thing that you wanted the world to know, or even just one person out there who's looking for help, what would that be?
Yeah, that's a really interesting question. I would say do scary things, do hard things. You're going to be better off for it. And once you jump in and do that scary thing, you're gonna be glad you did.
That's awesome. Okay. Why don't you just repeat for the guests where they can find you if they want to, after hearing this episode, get your help?
Yeah, so we have offices in Jessup and in Waterloo, just off of Kimball.
Awesome. Dr. Rottinghaus, my friend, my colleague, and just another good soul trying to do some good work for people in this world. Thank you for being who you are and being on this show.
Doc Rock, it's been great.
Awesome.
I was just going to ask you if you took after George Costanza, trying to get your own nickname out there.
Yes, I am. I say in the beginning, I'm like, hey, this is Dr. Rock. I hope people call me this, but no one ever really calls me this. It's kind of funny. One of my patients actually was just driving down to Cedar Rapids and they saw a license plate on a black Suburban that said Dr. Rock. My license plate says Dr. Rock with a 0. And so they thought it was me and they sped up. Apparently he's the original Dr. Rock. I'm guessing he's a geologist, not MD rock star like me. Anyways, for all you guys out there that are listening, thank you for another awesome episode, showing up, trying to make yourself better. Keep rocking your health. I'm out. The information provided on this podcast is for educational and informational purposes only. It is not intended as medical advice and should not be considered a substitute for professional medical consultation, diagnosis, or treatment. Listening to this podcast does not establish a doctor-patient relationship with me or any guest on the show. Always seek the advice of your own physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking it because of something you heard on this podcast. Use this information at your own risk.